Hi guys, welcome back to our channel. If it's your first time on my platform, you are welcome. My name is Priska and I'm a Cameroonian YouTuber, and on this channel we vlog about anything that's beneficial. Okay, so on today's video, as you may have noticed from the title of the video, we're going to compare Cameroon's medical system with that of South Africa. Yes, the South African medical system versus Cameroon medical system. Guys, talking about the medical system here, I'm talking about how patients are treated when they go to the hospital. Okay, what happens once you're already in the hospital? Okay, we are just trying on this video to let us know it's just an informative video. So if you're probably in Cameroon or in South Africa, you're sick or you're planning to travel abroad and for medical purposes, this video is going to help you to decide if you go to any of these two mentioned countries. So the first thing we're going to talk, it's just the most important one. When you go to the hospital, you need to consult, right? What happens when you consult? When you go for consultation, guys, to consult in Cameroon, guys, consultation in Cameroon is little bit much more easier if you're going to a private hospital. Yes, it's much more easier because many people they love private hospitals because of the quality of health care, but many people do not go there because of the money, the finance. Okay, it's pretty expensive most often. So when you go there, there are not so many people. You just have to go, you pay. Okay, you will not really meet so many people. But guys, if you have to go to a mission hospital or public or government hospital, guys, the queue in these places, people get up as early as 4 a.m. just to go and get a number. The line is, gosh. And many people will choose that because it's affordable. Yeah, it's pretty affordable. But in South Africa, guys, if you are sick, if you're not fine, if it's something you cannot handle in the house. When I talk handle, I don't talk about all this concoction they give you, country medicine as we call, and no. If it's not something like headache that you can easily drink paracetamol or Panadol to get rid of it, then you rush to the clinic. Okay, there it will be handled. You rush. It's not like it's according to levels. No, people of all classes, you rush to the hospital or you see a general practitioner that is going to handle this issue ASAP. There is nothing like, let me try if it cannot work before I go to the hospital. Now when you're in the hospital and you get to see the doctor and they realize that they cannot handle your case, okay? In Cameroon, they have to refer you to a different hospital. Now, referring you to a different hospital, it's always, gosh, they will quickly write down that document. But to get yourself discharged is always very, very, very hard, guys. Very, very hard to get you discharged. Sometimes you may even go to this referred hospital and you realize there is no space. All the rooms the wards are full, or maybe the healthcare practitioner, the doctor, the specialist is not around. You have to wait. In South Africa, on the other hand, guys, it is just the tic au tac, as we say in French, the tic au tac. Like if you get in here, you see the general practitioner or the private doctor, and they check you, they examine you, they realize it's not what they can handle. Immediately, within an issue of minutes, you're referred to the next level, level 1, maybe level 2, the next door neighbor. It is just going. If you go to level 1 realizes they cannot handle, they send you to the level 2 doctor. That is how it is just moving, guys. It is just moving. Some patients sometimes in Cameroon die not because they could not afford healthcare, but because of the delay sometimes to refer them or the delay to see a doctor. The doctors are trying their best. Yes, the doctors are trying their best. Guys, on this video, I'm not condemning any of the countries, okay? That's why I'm not talking about the work the doctors are doing. I'm just talking about what happens when you go there. The doctors are really trying their best, okay? If you don't meet the specialist, you will always meet the generalist. Yeah, you always meet a generalist that's going to check you, and he realizes that you need to see, you must see a specialist. Then he will tell you, go see a specialist, okay? Even if it means seeing the specialist in the same hospital. Now, what happens? Maybe you can be in a critical situation, okay? You are brought in there, you're in a critical situation. For those that take blood, you may need something like a blood transmission. There are blood banks, yeah. And many hospitals do donate. They have these funds open for good Samaritans to come and donate blood, okay? But sometimes, or most often, you know, this is Africa, and the standards of health and living are in stages. People are often sick, okay? So you have cases where somebody needs a blood transfusion, you go to the blood bank, you don't get it. And they start asking, oh yeah, call your father now, your mother, your relative. Your relatives have to come and gather, and they sort out the person that with whom you have the same blood group, for the person to donate for your life to be saved. What if you are an orphan? What if you are the type of child that lives without parents, a street child and all of that? You can't get family members that will come as soon as possible to donate that blood. What happens to you? That is just what happens. That needs to be upgraded. I don't even want to talk about medications. Guys, I don't want to talk about medications. Sometimes they'll prescribe you some medications, the doctor will realize, okay, this is the type of meds you need to be taken, and the hospital pharmacy does not have that available. You as the caretaker have to start going around searching for that medication and all of that. I know a case, it's sad to say, I know a case of a relative that died. It's 6 weeks now. The man died without even saying a word or saying goodbye to the wife. The wife at the time was the only caretaker in the hospital with him, okay? So they had to prescribe a medication, and the wife went in search of it. It's true he has been sick for a while. He has really been sick and sick and sick. But was away trying to get a medication. The wife only came. Guys, these are things that need to be avoided, okay? There are things, I don't blame our system, okay? Kudos to the Ministry of Health and the President of the state. They are trying hard to upgrade this thing. There are things we have to try harder in Cameroon. Whereas in South Africa, okay, everything the blood bank has always have its supply for the patients. Yes, the blood bank always have that supply. The pharmacy in the hospital always have supplies. You don't go around searching for medication to come and rescue your patients or your relative or your whatsoever. Okay? So that is just it. Okay? The next thing we are going to talk about, insurance. Yeah, medical insurance. In South Africa, guys, they're both the haves and the haves not. I mean, even the person that the standard of living is really low, most of them have medical insurance, okay? That once you're sick, you go to the hospital and the insurance take care of everything, okay? In Cameroon, we have medical insurance, but not for everybody, okay? You need to work in a good company. You really have to be working in a good company where you are medically insured for you to benefit from healthcare insurance. If you don't want to use your card, for some insurance companies that have a card, others you spend and you get reimbursed. It means you go and spend your money, and then after you return, you follow up for reimbursement. So that is it, guys. That is just how the medical system in both South Africa and in Cameroon work. Thank you so much for watching right up to this end. If you actually did, please support me. If you can, you know what you need to do if you want to support your lady, okay? And for our South African people in the family, thank you and welcome, welcome, welcome. Okay, so hit that red subscribe button if you've not yet done so. Until now and until we meet again, guys, take care. Love you. Ciao.